speakers on this show, and today we have none other than Dr. Nandita Palshetkar. So, Kavita, I'm sure this conversation is going to be very fruitful, and we'll have lots of learning points. Especially the topic is fertility, future of fertility in India, and we all know every now and then so many IVF centers are coming up, and in few countries like Europe, every almost 5% of the children born are through IVF. So I'm sure we are going to learn lots and have a futuristic ideas how this particular field is going to go in India in next few years. So here you are. Let's start with the show.
Thank you so much, Ashadi. Tuesday Tea Time is basically the Learn Simply with Kawita Bapat. It's a platform for conversation, insights, and knowledge sharing. And it's a dedicated sharing insights. We don't have any take-home messages. We have the take-work messages and the crisp knowledge about the subject, and with a conversation with the leaders who are very, very respective fields. They are very, very good. And we believe in bringing up the together people of the best people, and that can create a continuous learning and a knowledge. Today, nothing other than the, can you share the CV of this? Keep it. I'm not going to read anything out of it. And we also believe that every Tuesday, this concept, they invite the leaders and experts of the respective field and join the conversation. So love you, Nandita Palshetkar, madam, for being today with us. As being an IVF specialist for 28 years of experience and received several awards and everything, accolades and a contribution in the field. And you are also a fellowship of the Royal College. I'm really proud to be a friend of you. And it's a medical director of IVF Bloom, operating 7 centers across India and having the ART techniques of the world-renowned clinics in Belgium, Italy, and Copenhagen. And you have pioneered in advanced techniques which everybody wants to know from you. That's ICSI, laser etching, embryoscopy. And you have authored numerous books and chapters, and it's really commendable. In addition to that, you have a great leader. You're not a simple leader, I'm telling you. You're a leader with so many things which the leader one should have. How to delegate the things, how to keep calm, and how to make things done in a best manner that you know very well. And the most important thing is another cutting edge technologies, and you are bringing to this profiling speaker. And most important, Dr. Bakshi will also, and everyone who has joined today will agree with me, the Queen of Hearts and a likable person in a foxy and a friend of lifetime. So thank you being with me as such an extraordinary person today. And we'll have some small conversation between you. I'll ask few questions about the IVF and anything else, and any input which you will like to and tell to the audience, because infertility, their laws, their techniques, and everything is so much advanced is going to happen. So what will be the future of this country with the infertility treatments? And I think you are the right and the best person who is going to answer this today. So love you for today. Then the moment you want to start, just to introducing you, now we can start a dialogue. You tell me how to start. Should I start, or you want to say something and then we can start?
Hello, everybody.
Thank you so much.
Hello. I think, Kavita, thank you first for, can my chai be seen? Yes.
Yes. Thank you so much.
Pleasure to be here. Thank you for sending me the chai. Chai Pe Charcha is a really wonderful concept. And I think it's really wonderful to be talking academics, with in a conversational manner, because a lot of points, a lot of knowledge comes across, and it's a very the conversation, I think, is important. Otherwise, in this webinar format, people just tune out. So when there is a conversation between 2 or 3 people, I think it really helps. So I'm really happy today, and I've known all of y'all, you, Asha, for the last 20-30 years, and I'm really happy that we are on this journey together. And of course, I wish you all the best. And let's begin our Chai Ki Charcha. I'm all set, and I think I'm really looking forward to this conversation and this Chai Ki Charcha.
Thank you so much for being with us. Thank you so much. And now we'll have a simple things, because this take home and the take work message for all the Foxians, and they will love to know simply think in a simple and a crisp manner. So what new technologies and the techniques are being developed to improve the success rate in IVF in India? That's what I feel about. It's the first question that I
Let's mute everybody.
yeah, please mute everyone. Yeah.
So, Kavita, I think that's a very relevant question. IVF was first in 1978. The first baby was born, Louisa Brown, and we've come a long way, 40 plus years. And a lot of new technologies have come. And that time, you won't believe it, that Edwards and Steptoe had to try thousands of times before they achieved the pregnancy. The success rate was 1 to 2%, literally at that point. And today we've come proudly where we can say 50, 60% in good prognosis patients. And the live birth rates are around 40, 45%. Is what we can really proudly say. So this is because of three things. There are new things which we do pre-IVF for the patient. Then, of course, the laboratory, and there is post-IVF therapy also. So let us focus on the laboratory part because that is what we are talking about today. So in the laboratory, I think there are many new technologies which have come in. I think IVF was one big disruption, but after that, there has been vitrification, which was amazing. The egg freezing, the freezing technology which came about has improved the pregnancy rates by leaps and bounds. Then there is the time lapse, which is, in your telephones, you have this time lapse technology, which is fantastic. You can take pictures every 15 minutes, and that has really improved our pregnancy rates. Then, of course, the genetic testing, which is there, the pre-implantation genetic diagnosis. In UK, about 20% of the cycles are being done with genetic testing. In USA, 50% of the cycles are done. And in fact, when they saw that, they realized that the live birth rate didn't increase so much, but the time to pregnancy has improved. So that again, now this generation is always in a hurry. Remember that they are our children. We've given them everything and on platter. They cannot deal with negativity. They cannot deal with failures. They have only success because we give it to them. So time to pregnancy is very important. Otherwise, they go into mental problems. Then artificial intelligence has come in a big way. Artificial intelligence today, we are using it in, even in diagnosis and ovarian stimulation. I'm using it in my imaging processes, in a lot of everywhere, in every.
Nandita, I'm interrupting in between that. We'll ask one after these questions, one after them. So I'm so happy. But the genetic testing you talked about, and now you are talking about the artificial intelligence. Am I right? Yeah.
Yes.
Sorry to interrupt you. So the use of artificial intelligence and machine learning in a future treatment. Now you go with it. This is the question which I'm supposed to ask you. Yeah. Yeah.
Actually created something really nice about the artificial intelligence and the machine learning, because there are a lot of things which can be gained from artificial intelligence and machine learning. First thing is early detection and diagnosis. Because of this huge data which is there, you can actually create algorithms where you can early detection. For example, the other day there was a company which came with a machine which, if you just put the probe on the abdomen, you can pick up the contractions of the uterus and it goes into a machine and you can diagnose endometriosis. So, I mean, as early, even before it gets, early diagnosis of endometriosis, how much it can prevent infertility. So those are the things. Then the other thing is personalized treatment plans. With artificial intelligence and machine learning, you can definitely do personalized treatment plans for then also predictive analysis. Like I have a program with eggs, which is known as Magenta, or the program which takes pictures of the oocytes, and once you feed it into the program, it tells me the live birth rate of the frozen oocytes. So I have young girls who come to me for freezing for cancer, freezing for endometriosis, freezing for social reasons. Now, when the other day I had a patient of endometriosis, 26-year-old. She gave me only 4 eggs because of endometriosis. You know what was her live birth rate? Only 14% with 4 eggs. So now I told her, you need to give me more eggs. So it kind of tells you and is able to counsel the patient. Then also image analysis and embryo selection, because it is attached to our embryoscope. The new embryoscope which I has, you know, there are different ways of machine learning. One of them is convoluted neural networks. The other is artificial intelligence, has many different ways. So this convoluted neural network is used with the embryoscope, and it gives you fantastic. So I can do a day 3 transfer instead of a day 5 transfer. I have patients who have never developed blastocysts. So in those patients, when I talk to them, I cannot do a blastocyst transfer because I don't want to be with 0 transfer. So in that, the embryoscope would be fantastic in selecting the patients. The other thing that I have is treatment optimization and monitoring. Do you know, today I'm sitting at home and on my phone, I get the reports whether what is happening to my embryo. All the data is coming on my phone. If the incubator is not functioning properly, if the temperature has dropped, if the pH is not good, all the monitoring can be done remotely on your telephone. So all this is possible with artificial intelligence and decision support systems. Now, you know, the artificial intelligence with all the data can tell you that, okay, this is the correct decision, this is how to go about it. But remember, Kavita,
Yes.
all this intelligence is fine. It is the experience of the clinician,
Yeah.
clinical judgment, which is finally important. So you use this artificial intelligence as a tool to help you out, not primary. Okay.
Yes.
Clinical judgment is primary, and all this artificial intelligence will be plugged in to help you out. I think this is what one must remember when you're using this. Even in chat GPT and all, they actually write, you have to, you know, it's still.
You have to have inputs. Yeah.
Yeah,
Yeah.
definitely.
You have the inputs.
Sorry, talking
You should
fast.
have.
I
Yeah.
don't know how much time we have.
Yeah, no, we have enough time. We have enough 20 minutes time, nothing to worry about. And we are going to talk about all the latest things which you are very much into it and doing it, and you'll bring to this country. Yeah.
I love it.
Yeah, you are the person who is going to bring all this. They're really so important about the verification, the egg freezing you talk about, the time lapse you talked about. Artificial intelligence is going to take many more things from us, but still, we are always there to look after things and the embryoscope and everything. But what I feel that, do you think that's in a crisp and a very small way? Can you tell me that what the government policies and the regulations we have on the availability, and number 2 is the affordability of the infertility treatments in India? That's another important point for us.
It is very, very relevant question, because right now everybody is so hassled about the government law which has come. You know, it's so bad, it's so draconian, it's so horrible. I think we have our own selves to blame for it.
Yeah.
There have been so many atrocities on women. See, remember one thing, gynecologists have the maximum laws against them. You know, after serving as a president in multiple organizations, I think Foxy was something that was an amazing organization to be president of, because that is where I realized the importance of being a gynecologist. Because when I was interacting with the government, with the policy makers, we realized that women, uh, overall, women are the most downtrodden. Women are the most,
Commodity.
no, they are not treated well. They
Yeah.
are the most, like how we have, reservations for
Yeah.
OBCs.
Yeah. It's
Right? That is the problem with women. They need reservations. They need special concessions because they are not given equal rights. And believe me, you and me are an exception. We are educated, we are empowered, but women need empowerment. And that is why all these laws have come.
Correct.
And I think even in the reproductive medicine where the law has come, it is to give women their empowerment, to give them their reproductive rights. And
Correct.
it will, maybe right now it's draconian, but down the years, 10 years down the line,
Yeah.
my son Rohan will enjoy the
The laws. Yeah.
he will enjoy it. We will have difficulty.
Right.
But let me tell you what are the advantages. I think the three A's are very important.
Okay.
The first is awareness,
Correct.
second is accessibility,
Yeah.
and availability.
Correct.
I think what the government thing has done is it has created an awareness
Yeah.
that infertility is not a social disease, it's a disease, and it has given it insurance cover. See,
Correct.
that awareness, it has put it in the line of that this disease needs an insurance cover.
Yes.
Till now, it was not anywhere in the insurance agency.
Yeah.
So I think that insurance cover is something really important that has come about. Secondly, the price regulation. You know, about the third party reproduction.
Yeah.
They're going to
Yes.
regulate the prices. So I think it is, in a way, it's good. Then accreditation and quality control has come in. You know, be it infrastructure, be it the training, be it the qualifications, all those things have come into place. So you have to have quality, and the quality control has come in. Then the awareness I've talked about. Then ethicality.
Correct.
Ethicality has definitely come in because you can use, like for donor, only one donor per person. You cannot use more than 7 eggs. See, lots of atrocities were being done. Yeah, it's going to be difficult. It's going to be tough, but things will settle down and things will move in the right direction. So overall, personally, if you look at me, I think it's a very
Very
good.
good.
It needs a little bit, it needs a bit of twitching so that it becomes implementable.
Correct.
And that is what is important. And also, people need to know the law. So, on behalf of ESAR, we are now conducting a lot of CMEs so that we can tell the people. And I think gynecologists, especially since your forum is an open forum, I want to tell the gynecologists that you need to be registered under the law as a level 1 clinic to be able to do IUI. You cannot do IUI if you're not registered as a level 1 clinic. So if you're not registered, go to a level 1 clinic, register yourself, or send your patient there to do IUI. It is very, very important. You may just continue doing it, nothing will happen to you. But one problem and you are in trouble.
So basically, the government policies and the regulations have a significant impact, as you say, as well, in a future. And another important point, as the insurance things have come recently, and we have seen it's a very nice how the insurance coverage for the infertility treatments, because it enhances the affordability of the patients. And
that is a very good example.
Yeah.
You have it in Ayushman Bharat.
Yeah, yes, absolutely.
And that is what we are pushing for. That it should come in Ayushman Bharat, because what happens is, the equity, I think, making it affordable and available to everybody. Ayushman Bharat makes it. So in fact, I always, whenever I'm talking to my government, Maharashtra government, I give the example of Madhya Pradesh, that it is affordable and it's under Ayushman Bharat. So everybody gets a chance.
It reduces the financial burden of the individuals and couples seeking for the assistance. But the most important point which I feel about the government policies and regulations is, at the end of the day, we need more research. They should provide and they should encourage the innovation into the field also. The government should do with not only the put the laws only, but they should have some research and innovation in the field and allow the patient for the ethical practices and the safety, which is another important point at the end of the day. But now my question is, how will be the changing social and cultural attitude towards fertility? The country or the population of the number 1 in the world with the population, sorry to say so, we have the family planning impact in the demand of the infertility treatments in India, which I'm sorry to say it, but this is a need of a time. So I think you are the right person to talk about.
I'm always asked this, that why do you need to have a child?
Yeah, I know the question is different, but I'm sorry to say,
promoting
how the impact impact of family planning and demand of infertility
I
treatments?
think it is very individual. You cannot tell a person that don't have a child just because the
Yeah,
population is
yeah,
increasing. I think it's an individual's reproductive right to have a child. It's a fundamental right of a person. You can't take it away. So yes, you work on the other side of it and keep the population under control by
My
doing.
other things, my other things.
You can discuss that in your other chai pe charcha.
Yeah, you are right.
But
Absolutely.
I think
I agree with you.
yeah.
I totally agree with you. It's a human right. Same with the it's a lawfully they can demand to have a baby or not to have a baby. That's very, very important. So instead of going into that field, we
Yeah,
can
let's go there.
Yeah,
So I
yeah.
think what we are seeing, the social changes, the cultural attitude. Now I'm seeing girls who are, delaying their age at marriage. They are going for education. And some of them are genuinely not finding partners because they're so busy with their careers. A lot of girls are, working so hard. So they don't have time to socialize, to find the right partners.
Yeah.
It just is impossible. So delayed parenthood is also one of the reasons where they are not having children. Then there are on the other extreme, like DINK, double income, no kids. They don't
Yeah.
want to have children. They are saying we are having fun, we are enjoying, we don't want to have any children. Then awareness and acceptance is also important, that it's a medical condition.
Yeah.
And it needs treatment. I think when I began practice, Kavita, initially only the wife used to come, but
Yeah.
now I see the couple coming together as a unit, and that has definitely changed. That the couple is accepting that it is a problem which can happen because of both of them. Can I tell you something really something different?
Yeah.
Before 1957, there was no concept of male infertility.
Yeah.
1957, the first paper was published, which actually did a semen analysis and showed that there was a male factor.
Yes.
50% of it infertility is caused by male factor.
Correct,
Can you believe it? And you won't believe it, in the 1800s, Aristotle actually said,
Yeah.
"Man is supreme. Everything arises from the sperm."
Yes.
And William Harvey was the one who said egg is the one which gives rise to life, and the
Right.
germline is immortal and it comes from the egg. So I think we women have always taken the back seat, whether it's in our Vedas or in the
That is old,
Greek
old.
philosophy or
Yeah.
the English philosophy. But
Correct.
okay, let's go back. I think even the technological advances which have occurred have made it popular. So I think the other things, and even the social things, like some of the things I see in my thing is, पहले भगवान करेंगे, पहले मंदिर जाएंगे, ये करेंगे, वो करेंगे. They
That they good.
that those taboos and myths and those things also sometimes deter couples from coming to clinics. But I think the awareness is very important, and we are definitely spreading their awareness.
Knowledge.
I think the support systems are not there. They are nuclear families now. And I think today's mother-in-laws, that's you and me, or today's mothers, parents, that's you and me again, are very supportive. We don't push them, because I get a lot of couples who say, oh, no, we don't have pressure.
Yeah.
Our parents are not pressurizing us.
Correct.
But it is self-pressure. That's what I tell the husband. The woman is under pressure because people around her, her friends and all are talking about nannies. My child is eating this. My son is going for this class and that class. So her peers are talking about children and the classes and all. So she feels stressed.
Yeah.
So she feels pressurized. So I think these are the social, cultural things that are happening around her. And that is what pressurizes her. So you have to do that. And of course, the financial considerations are always there. IVF is. But I think with all the budgets, solutions that we offer them loans, we offer them, what is that? You give them
advices, no, or some
you can give they can pay part payment. I don't know what
EMIs. EMI.
EMI.
What is EMI? Yeah.
EMI.
Yeah.
EMI payments and all those things. But I frankly don't like EMI payments because out of every two patient, if one doesn't conceive and they're still paying their EMI, they're going to give you galis all their life.
Correct. You're absolutely right. As you have done so much thing, as I've already talked about, and you speak such a good series of lectures or anything on regarding the mitochondria and everything. That's a really great. You talk about sleeping beauty and so many things. But do you think that the male fertility is more concerned point, as you already have started this topic, that the male fertility should be given the great more focus on in the future, and what new techniques for them to be developed and what we should address on it? Because female, as you already said about it, so the male fertility is another big focus point in the future.
I think, Kavita, you've really, in Marathi, we say duktya naswar.
Dukti rak par haath rakhna.
He's also not good. English is also English is also Kolhapuri English, according to my not Shakespeare English. But I feel the male is what has happened is the advances have happened in the lab in the male infertility. There is no treatment by which we can improve the count or improve the problem, the basic problem that is there, so that they can conceive naturally. That is the problem that I feel. In the male, whenever we find a problem, we can do ICSI, we can do microfluidics, we can do MAC, we can do IMSI, we can do PICSI, and we can really help them out by doing laboratory things to help them out. I don't have a treatment like I can give them tablets, I can give them FSH injections, and I can guarantee that, okay, now your count will go back to normal and you'll conceive naturally. That is where the lacunae actually exists. I feel that is what is lacking over there. So yes, we always say that the female is more difficult to treat because we cannot produce the eggs. But I think in the male, this is where the mental trauma is. That there's nothing that we can actually treat them and get them to conceive naturally. But I think the diagnostic tools could definitely improve because besides the semen analysis, there's nothing really much. The DNA fragmentation is okay, it comes into favor, it goes out of favor, even the semen culture comes in and goes out of favor, all that computer, quality analysis and all that. But I think those things are there. And of course, the micro TSA, which are there, that is a fantastic technology. I work a lot with a lot of patients with zero sperms, and we are getting very good sperms. But believe me, my team spends 4 to 6 hours to 8 hours
to find out,
to looking for sperms. I think that is a beautiful technique to help these sperms. And today I'm using precision medicine for these men. And a lot of them have the CATSPR or the FSH gene polymorphism. And when you give them FSH injections, it definitely improves the chance of getting the sperms. So I think there is a role of precision medicine, though it's not evidence-based yet. I think in future, it will help a lot. Then, of course, we have this new technology, which I'm using in the lab, which is sperm VD. So if I find just 5 sperms or 6 sperms, I can freeze those single sperms. Because otherwise, when you freeze sperm and you have only 10 sperms, if you freeze them in the regular sperm freezing way, you cannot retrieve these sperms. But in the sperm VD, you can actually freeze 6 sperms, 8 sperms, 10 sperms, and retrieve these sperms. So it's a beautiful technology which has really helped this. The other new thing is, of course, the stem cells which are there. Those are being tried to be injected in the male without any success at the moment. But I'm sure that will happen. And creation of the sperms from stem cells, it has achieved in the mice, and a litter of mice have been born from the skin cells. Who knows what will happen in the humans? Maybe we don't need the man anymore and sex will only be for pleasure, as I always say. And reproduction can be in the labs. So those are some of the things. And genetic changes. You have micro deletions in the husband. You have the MTFHR genetic problems, which can gene editing or even genetic diagnosis we can
Correct.
do, and see that the next progeny doesn't have it, so we can actually
Yeah.
eliminate
Without that, also they will conceive.
absolutely.
Yeah, when we were kids and we used to see the star tech, we never thought about it. That the many of the things we'll see very soon in future, like having a screen, putting a finger, going from one to another things. So we are finding it very normally. So at the last question, will I love? So you have put so many good things about the male points and the techniques about the XC, the TISA, and the pharmacological as well as the stem cell therapy in the future. So, and the last thing is, do you think that the advancement of the stem cell research and regenerative medicine will impact in India, and what will be the ethics, what will be the regulations, what will it will end up into it, and how the costly it will be? So it's a big question, but I'm sure that you are going to answer in a way the way you always do. So over to you for the stem cell research and the regenerative medicine in the future.
Stem cells, it's fabulous.
Correct.
I think it has a lot of potential, and it is there in India. We know there's so much, but stem cells is a very abused thing also.
Yeah.
It just anywhere. I remember the first time I heard of stem cells is when I went for my hair treatment.
Yeah.
They said, "Oh, we have apple stem cells for your hair." And they infused my head with apple stem cells
Yeah.
to improve the hair quality and improve the number of hair follicles in my head. So stem cells are omnipresent, as I call them. But of course, if you look at it in our field in reproductive medicine, I mean, you're putting stem cells even in your face.
I know.
And people are taking stem cell infusion. So yes, but that is the whole problem. It is totally unregulated, and we don't know the thing. It has tremendous applications. I think what stem cells at the moment, what stem cells is really doing is giving us an in-depth information. It's
Please mute. Please
Yes,
mute.
muting.
Yeah.
It is giving us an in-depth way to study eggs, sperms, etc. I think it's really helping us do a lot of research. Then it's helping us, when we do ART and all, we can actually get out the inner cell mass, and that is helping us in research. And whether these stem cells can be, there's a lot of studies going on to create organs.
Yeah.
Stem cells can create organs. You do 3D printing of the ovary scaffold, and you can just put these stem cells, the primordial stem cells, and create an ovary, which is the work of Susan Poor, which is happening. And she's like 5 years away from creating a human ovary.
Yes.
So not only ovary, different organs they're looking at creating.
Yeah.
Then gamete production from stem cells has already been
In a pipeline.
and this Yamanaka factors which are there, I mean, they are being used because what happened with Dolly was when she was cloned, she had all the symptoms of old age.
Right.
Because when the cells were created, the stem cells were old, they were not rejuvenated.
Right.
Yamanaka factors are the ones which rejuvenate the germ cell line. So that's the Nobel Prize which Yamanaka got, the Japanese the Japanese scientist got it. And so now those are being used, and a lot, and he has created artificial embryos in the lab. So these are all stem cell derived research. Then of course, fertility preservation, if you can preserve the stem cells, it will really help those who have got low thing. And I feel even the anti-aging, may be helped by stem cells. So ovary, if you inject, now we are doing ovarian rejuvenation with the stem cells. We are doing endometrial rejuvenation with the stem cells. But of course, what I feel is there are ICMR has guidelines. ICMR has permitted certain institutes to continue the stem cell research, and the stem cell research going on abroad and in our country is showing promise. So I hope
things will be better
related, and we will see its effects in different. And I think it gives you a personalized medicine approach with combining it with the non-invasive, with all the data that's coming in. And as you said, artificial intelligence, machine learning, big data,
Everything.
combined with all this research that is coming out, we may really get some very good answers.
Correct. Now, Dr. Bakshi is with us. Dr. Asha, Bakshi is Vice President Foxy. Dr. Bakshi, will you like to conclude something or talk about, or do you want to any question to Dr. Nandita Palshetkar regarding this?
You're muted.
Please unmute yourself. Yeah.
First of all, I would like to thank Kawita for taking us to future so beautifully. So beautifully. It looked as if things are going to be so easy and so wonderful, and it makes you feel positive. See, otherwise people always talk about depressing things, but I like positive things. And this is what today Dr. Nandita Palshetkar has told us, that there are so many things that can be done, that will be done. And India is not going to be back anyway soon. We will get the technology. We are getting very fast in getting the technology. And there is a lot of role of stem cells, rejuvenation, artificial intelligence, and all these things will come in our day-to-day practice. And ART law has really made the things very easy, has made the things easy for future. And I'm sure once the things get so streamlined, then even medical tourism will increase. At the moment, people have to, abroad, they want to have trust. So once such things are there and the standard of ART practice goes high so much, then medical tourism will come in a big way. So all these things are really positive, and thank you for ending the whole conversation in such a positive note. Thank you.
Thank you so much, Asha. Today in the future, we all talked about the fertility treatments is likely to be very much characterized, personalized, targeted approaches, and advance in genetic testing. Telemedicine is there, artificial intelligence is there. So much things are there, and a very great focus into the male fertility also is going to be happen. So thank you so much, Nandita madam, for being with us. And I'm really pumped